Factors affecting oxygenation and respiration. We have external factors. Adequate respiration requires proper ventilation and oxygenation. External factors in ambient air have a key role in overall process of respiration. Example, atmospheric pressure, if you're high up in the mountains, or in a sub that is looking at the Titanic. Partial pressure of oxygen. High altitudes, percentage of oxygen remains the same, but partial pressure decreases because total atmospheric pressure decreases. Closed environments also have decreases in ambient oxygen. We have mines and trenches and what are these called in fire? When it's a space that not normal humans would be sustaining life in. What is this called? Trench? Confined space, confined space. Toxic gases displace oxygen and environment, making proper oxygenation and respiration difficult. In particular, carbon monoxide has a greater affinity for hemoglobin than oxygen does. How much? 250 times more. So you have oxygen molecules, you have hemoglobin, and then you have carbon monoxide. It's going to knock the crap out of all the oxygen ones to get to the hemoglobin 250 times more than the oxygen is going to attract it. Inhibits proper transport of oxygen to tissues. That's what makes it so bad. That's why you don't run into a house that's on fire. Also, there's cyanide and all the other gases, but carbon monoxide is one that happens as well that is going to prevent you from oxygenating yourself, and you'll get headaches. You'll start to feel headaches. Internal factors. Conditions that reduce the surface area for gas exchange also decreases the body's oxygen supply. We have medical conditions that also decrease the surface area of the alveoli by damaging them or by leading to an accumulation of fluid in the lungs. Non-functional alveoli inhibit diffusion of oxygen and carbon dioxide. Blood entering the lungs from the right side of the heart bypass the alveoli and then returns to the left side of the heart in an unoxygenated state. This is called intrapulmonary shunting. So inter, just like intranet is all in one network, not going outside. Pulmonary, we know it has to do with the lungs. What is pulmon? I think pulmonary is just lungs. And then shunting, so returns, blood is entering the lungs from the right side of the heart. It's this side, bypassing the alveoli, so it's not even going through to do gas exchange, and then returns to the left side of the heart in an unoxygenated state. So it's shunting, it is taking a river, it's taking a shortcut, right? Mario Kart, we got shortcuts, you're not supposed to go that way. Well, the blood is taking a shortcut to get to where it's not supposed to be. It's not winning the race, it is actually killing the person. Submersion. Victims in patients with pulmonary edema have fluid in the alveoli because they have edema. Edema is swelling. Enter. I think this is a word. Edema? I can't remember this word in Greek. Inhibits adequate gas exchange at the alveolar membrane. Results in an increased oxygenation and respiration. Exposure to certain environmental conditions or occupational hazards could also result in fluids accumulating at the alveolar over time. So we have high altitudes and epoxy resins. Occupational hazards could result in fluid accumulation. So if you're at a high altitude, you'll get, interesting. These conditions can result in anaerobic respiration and increase in lactic acid accumulation. Can result in life-threatening conditions. Submersion. Cool. Other conditions that affect cells. So we have hypoglycemia, oxygen and glucose levels decrease. The body is unable to meet metabolic needs and maintain homeostasis. Then we have cell death is going to be likely. Then you could get infection as well. So increases in metabolic needs disrupts your homeostasis and will lead to death if not corrected. How many slides are in this? Wow, 350. This is a big one. Of course, all the important ones are big. Hormonal imbalances. If insulin levels decrease, cellular uptake of glucose will decrease. Cells will metabolize fatty acids. Result is ketoacidosis, a form of metabolic acidosis. So cells are going to take away fatty acids, decrease cellular uptake, glucose will decrease. What do we have, 5 minutes? Conditions such as heart failure and cardiac tamponade inhibit the heart's ability to affect or pump oxygen blood to the tissue. So what's happening in tamponade? So same as pericarditis, inflammation. Cardiac tamponade, there's fluid building up. Your heart, right? We just look at the heart and we know it has components on the inside. It's where the blood goes through. But even around the heart, you have a pericardium. I think it's called the pericardium. You have a sac, like heart sits in a sac. There could be fluid, blood that gets in this sac. Now the heart isn't pumping against what it normally does, air, I guess, or your body, like where it normally has room. Now it's pumping against this fluid. You're adding a fluid, is it normal force? I don't know what physics would call it. You're adding friction and restriction of force that the heart has to compensate against, making it work harder or not even letting it reach its full potential. So that is what happens with cardiac tamponade. It inhibits the heart ability to effectively pump oxygenated blood to the tissues. Blood loss and anemia reduces oxygen carrying ability of the blood. Not enough hemoglobin molecules to bind with the oxygen. So if you have hypovolemic shock, you've lost too much blood because someone shot you in the femoral artery, then that's going to cause not enough oxygen to get to the rest of you because there's not enough blood to carry it. Same if you have anemia, you have blood, but you don't have enough red blood cells, you don't have enough hemoglobin that is transporting that oxygen for external respiration and internal respiration. Hemorrhagic shock, yep, this is if you get shot. Causes inadequate oxygen delivery, we know that. Vasodilatory shock caused by an increase in the size of the blood vessels. So this is your femoral artery, now it's yay big. Why is my battery already dying? Bro, I charged these. So if it does that,